All right. Fingers crossed.
Oh, it's working.
Great. All right. Good evening, everyone, and welcome. We are very excited today to have a wonderful special guest with us for the last workshop in our series on having a baby or preparing for a baby during COVID-19. But before I introduce her, I will go ahead and introduce myself. I'm Kristen with Reach Out and Read. And then we also have Carrie with Reach Out and Read.
I'm Carrie.
And Michael with Reach Out and Read.
Hi, everybody.
And so, as I mentioned, today is our workshop, our final workshop in our series about preparing for a new baby during COVID-19. With all of the social distancing measures, we know it's a lot harder to access information or attend parenting classes on what to expect when bringing home a new baby for the first time or for not the first time. So today we have a wonderful Q&A session with the incredible medical expert, pediatrician, Dr. Gina Reinoso, who is a pediatrician at Nassau University Medical Center in Brooklyn, to help us answer some of the questions and concerns you may have. So in the first 3 weeks, we covered maternal health, child development, and infant safety. And today we will be asking Dr. Reinoso about her take on all three of these topics and more.
Bueno, buenas noches. Thank you very much for inviting me. I'm a pediatrician. I work in Long Island. Bienvenidos a todos. Les damos una cordial bienvenida para hablar acerca de lo que podemos ofrecer acerca de información sobre depresión y qué hacer con un nuevo bebé en la casa. Con ustedes está Emily, Michael y Cari. Así que les damos la bienvenida a todos y esperamos que la información que les demos sea de su agrado y que tenga toda la comprensión.
All right, so first question, and I realized I forgot to change my name. I am not Emily, I am actually Kristen. Sorry.
All right, well, I get to kick off this session by asking our first question. Now, the first week in our series, we talked a lot about mental health struggles that new mothers might face in more general terms. We talked about some depression potentially during pregnancy as well as postpartum depression. We were hoping that you could talk a little bit about what sort of COVID-specific mental health struggles during this time of social distancing, of isolation, as well as the grief around the loss of typical social experiences that one would expect when becoming a new mom. So what challenges these new mothers might face and what advice you might have to manage these mental health struggles during this time?
So in general, we know that being a new mom is a new experience, and that itself causes a lot of stress and a lot of anxiety. And just imagine now having to deal with a situation like the COVID pandemic, being isolated, not able to introduce their new baby to the family, to the friends. So this is a totally new experience for these parents. And we know by research and data that parents or new moms are basically, their anxiety and stress levels have triplicated. So it is a challenge that we are facing now. But there are some things that we can do to decrease this stress, decrease the sadness, like having a connection with the family. So now we have technology in our hands, so we can use the technology in a good benefit. So we can maintain that social connection with the families, with friends by phone calls. So making phone calls and now video chats through FaceTime to Zoom. So that is very, very important. But sometimes that's not enough. So we understand that just having a connection through video, it's not the same as having that personal connection. So what we can do is that we can encourage parents to have a good attitude and accept the reality that we're living right now, and tell them or encourage them to engage in healthy activities like exercising. The three basics that I always tell my parents and my patients is like three main things: exercise, maybe going out for a walk for 20 to 30 minutes, of course, if the area is not crowded, if there's no risks, having a healthy diet, drinking lots of water, and sleeping. And I know that's a challenge to tell a new mom that you can sleep your 8 hours that you need. Such a difficult, because on average, a new mom will sleep anywhere from 5 to 6 hours. But we can tell the mom that you can nap when the baby sleeps, and you can do your best. So basically is that we recommend mommies to do what they like the most, what they enjoy. Also, they can try by reading a book, cooking, maybe gardening, something that they really, really, really enjoy. So the key is just to keep that daily routine. That's what I would recommend. So, entonces ahora les voy a decir en español. La pandemia del coronavirus representa un reto muy grande para todos, tanto para las nuevas mamás como también para las mamás que ya han tenido otros bebés antes. El estar distanciadas de su familia, porque el nacimiento de un bebé es tan importante, porque conocemos de que llega su familia, sus amistades, a conocer al bebé y hay esa comunicación. Pero lastimosamente en el tiempo de coronavirus no lo podemos hacer. Pero yo les puedo recomendar de que a pesar de las dificultades podemos tratar de mantener esa conexión, tal vez a través de llamadas telefónicas, a través de video chats, sea por FaceTime, por Zoom, hay tantas, WhatsApp, así que podemos ingeniarnos y tratar de comunicarnos, mantener esa relación con la familia, mantener esa relación con las amistades para introducir el bebé, para que haya esa conexión con el bebé. Pero sé que tal vez eso no es suficiente y a veces a los papás, la mamá especialmente, le falta algo más. Entonces, lo que les recomendaría a esas nuevas mamás es de que hagan ejercicio. El ejercicio es muy importante, tal vez salir a caminar unos 20, 30 minutos, comer saludable, muy importante, tomar mucha agua, dormir. Sé que dormir es un reto para una nueva mamá con un nuevo bebé que requiere alimentación cada 2 o 3 horas, pero mi recomendación es duerma cuando el bebé duerma. Hacer las cosas que más les gusta. Por ejemplo, si a una mamá le gusta cocinar, tal vez ir a cocinar algo que le guste, tal vez hacer jardinería, leer un libro, tal vez ver una película. Lo importante es de tratar de mantener una rutina para que le ayude a despejar la mente y ayude a conectarse con ese bebé.
All right. The next question we have for you is, can you tell us a bit more about what practical tips you may have for new parents who now might face job insecurity along childcare responsibilities?
Mm-hmm. So job insecurity, we know that millions of people they're losing a job, and that is really a bad situation. So what I can recommend is that you should allow those feelings of frustration and sadness. We have to accept the situation, but we have to maintain a perspective. We have to have productive thoughts, so we can think about a plan to help or assist our family. I can give you some tips maybe at home while mom is looking for a job. Maybe she can ask family members, the older siblings, maybe the partner to help care for the baby, carrying the baby and bonding with the baby at the same time, which is so important. Give yourself a break. sometimes we have to think about and just stop for a minute and give ourselves a break. Meditation has proven to decrease sadness and increase happiness. So I will recommend people to meditate. There are so many apps online, free apps online. Maybe reach out. Our Michael or Kristen can give you the name of the apps. But there's so many online, YouTube, that you can try to meditate. Do breathing exercise, very important. Just breathe through your nose, hold your breath for 3 seconds and let it out. Sometimes we need that breathing, that taking a breath. Look for resources in your community, maybe through a church, maybe through a health center, maybe the pediatrician can have resources. Maybe they have a social worker that can help out. Always talk to someone, talk to your employer. If there's a problem, maybe fear of losing medical insurance, which is so important. There's the affordable health insurance online. So if you go to the local or the governmental website, you'll find information about that. So there's always help. There's always resources. You can also, parents can also apply for unemployment insurance. They can ask their employers. They can go online through the local governments and do the application, file the application, but make sure you put the right information so people can contact you and you can get the benefits of that. So I think, yeah, those are the tips that I can give you. Y bueno, en español la pregunta era si es que cómo podemos hacer en tiempos tan difíciles, ¿verdad? Acerca del peligro, muchos padres de familia están perdiendo su trabajo y la inseguridad laboral. Eso es algo muy importante que puede provocar mucho estrés en la familia, con la mamá. Entonces, lo que les puedo recomendar es que pueden, por ejemplo, la mamá puede solicitar ayuda de familiares, de los hermanos que sean mayores, de la pareja, el papá, que pueda cuidar al niño para que la mamá se enfoque en buscar tal vez trabajo, buscar un plan B para ayudar financieramente la casa. También tiene que reconocer, mamá, que a veces no se puede hacer todo. Tiene que parar un ratito para meditar. Existen muchas websites donde les dan de forma gratuita apps acerca de meditación para que puedan meditar. Existen muchos recursos locales que ustedes pueden a través de su oficina local, del departamento de salud, tal vez en la oficina médica, en una iglesia cercana. Existen muchos recursos. En el caso de que hubiera una posibilidad de perder el seguro de salud, tanto del niño como de la mamá, recuerden que el gobierno ofrece seguro de salud de bajo costo y eso lo pueden hacer entrando al website donde pueden aplicar para el seguro. También hay oportunidades del seguro del desempleo, que ahora sabemos que están aprobando leyes y van a aprobar otra ley para asegurar de que las personas que están sufriendo probablemente de la pérdida de su trabajo, de que puedan aplicar para estos seguros de desempleo.
Thank you, Dr. Reinoso. You're doing double duty here. So we appreciate you. Get a drink of water or something. We don't want to run you ragged here, but thank you. This information is amazing, so we appreciate it. So for our third question, we were wondering basically, what are some ways that new mothers can build a healthy bond with their babies despite this time of social distancing?
So maybe if we look into everything that has happened, right, there are some positive things that we can see. Maybe we see the world in a different way. So the pandemic has brought up some positives, and I can say that maybe one for the moms is that they have been able to stay at home more time, to spend more time with their family. and with their new child or with their, with their other children. So that is very, very important. But I can recommend that also that parents or new moms can connect to the baby by doing this. First of all, touching the baby. That skin to skin relationship is so important, and we know that from birth, right? Because the first thing now that they do when the baby is born, they put the baby right on top of the mom, so baby can feel the mom, smell the mom, hear the heartbeat of the mom. So it's very important. We recommend parents or moms to have that skin bond, cradle the baby, rocking the baby gently, of course, stroking the baby. That feeding time, especially with babies who breast milk, and we encourage mommies to breastfeed, having that baby, that skin next to them, having their babies feel, how warm mom feels, her heartbeat is so important. And if father, the parent or the partner wants to join, he can definitely do it by bottle feeding and having that baby next to him. That eye-to-eye contact too. I always tell my new moms, look at the baby in the eye, talk to the baby. You might think the baby will not look at you or might not understand. Yes, they do. So look, that eye-to-eye contact is so important. Talk to your baby, sing to your baby. And I tell them it's never too early. Since that newborn visit, I tell moms to talk, to sing, to look into the eyes. So it's very, very important. Those are like very important tips that moms can do with the baby. Another thing that we suggest is massaging the baby. And this is very important. And there's so many, videos that how to do it. But basically, you can do just as basic as this. You put the baby on a blanket, a baby on a diaper, gently with your hands. You just touch his face, touch his body gently. You don't have to do much. And that's it. If your baby has any medical conditions, of course, you need to discuss that with his or her pediatrician before you do anything. So I think that I had covered that question, so I'll do that in Spanish. Es muy importante que la relación, crear esa unión entre la mamá, también el papá y todos los otros miembros de la casa, tal vez los hermanitos, ¿verdad? Con el recién nacido. Es tan importante tener ese contacto piel a piel. Si recordamos ahora que esto está muy de moda, cuando nace el bebé le ponen en el pecho a la mamá porque el bebé tiene que oler a la mamá, el bebé tiene que sentir el calor de la mamá, el latido del corazón de la mamá, y eso crea una unión muy importante. A pesar de que el bebé es un pequeñito, eso crea una unión muy importante ya desde ahí. También mirar al bebé, ¿no? Es importante mirar al bebé ojo a ojo, esa comunicación visual, hablarle al bebé, cantarle al bebé, el darle el pecho materno es tan importante. En ese momento existe esa conexión, esa unión con la mamá, el bebé junto al pecho de la mamá, recibiendo el calor de la mamá, sintiendo el latido del corazón. Y en el caso de que el papá también quiere integrarse, puede alimentarlo con un biberón, un tetero, poner a su bebé entre sus brazos, acariciarlo y alimentarlo. Entonces, eso es muy importante, esa conexión desde que nacen los bebés, y eso va a ayudar mucho con el desarrollo y el estado emocional del bebé.
Wonderful. You already started talking about this, which is awesome. And in a previous workshop, we also talked about early brain development and how those environmental inputs, like talking with your baby, reading, singing from the very, very beginning, and even before the baby is born, helps actually build the child's brain. So from a pediatrician's perspective, what recommendations do you have for parents to promote this early brain development?
Mm-hmm. So studies have shown that the first 3 years of life, that's where all the brain connections are like developing, right? So it's a big explosion of connections and brain development. So we have to remember the 5 R's to build that critical, social, emotional language skills. And this is very important to start as early as the newborn, because we will nurture the child's development. So what are those 5 R's that we talk about? So reading to the baby. And as I said before, it's never too early to read to read to the baby. I tell my parents, grab a book with colors, you know, the older sibling books, just show it to them. Just show pictures of faces. It doesn't matter. Just read to the baby. 10 minutes, 15 minutes, it's enough on a daily basis. The next thing is rhyme. Singing, talking, you know, every time you're doing something with your baby, just, you know, sing, talk, never stop, because that helps the baby with his emotions, his language development. And it's so important for them. The other thing is develop a routine, right? Especially for meal times, and especially we say, you know, try to sit together at least for one meal, the whole family. Develop routines with sleep time. Develop routines with family times is so important. Build that relationship by protecting the child, supporting the child, nurturing that child. It's so important. Remember that the first 3 years of life of a child, they're like very precious. Y en español, me preguntaban acerca de cómo hacer que los bebés se desarrollen, ¿verdad? Es importante recordar, en inglés tenemos las 5 R's, para español no va a traducir igual, pero es muy importante que entendamos que durante los primeros 3 años de vida de un niño son tan importantes, porque ahí es donde se da la conexión aquí en la cabeza neurológicamente para desarrollarse, para desarrollar lenguaje, emociones, desarrollo motriz. Entonces, es tan importante ofrecerles oportunidad al bebé. ¿Y cuáles son las 5 R's? Bueno, las voy a traducir en español, aunque no son lo mismo. La primera es lectura, leerle al bebé. Y siempre yo les digo a mis pacientes, no es muy temprano para leer, así que desde pequeñitos, desde recién nacidos, se les puede leer un libro. Por ejemplo, mostrarle un libro a un recién nacido de caritas, ¿verdad? Leer 10 minutos, 15 minutos, es tan importante. La segunda cosa es rimar, ahí sí tenemos una R, rimar, ¿no? Cantar, rimar, hablarle constantemente al bebé, eso es tan importante. Desarrollar rutinas con el bebé o con la familia, ¿verdad? Por ejemplo, la hora de la comida, el tiempo de juego y el tiempo de dormir. Desarrollar rutinas es algo muy importante que ayuda al desarrollo emocional de un niño. Básicamente, si algo tengo que resumir, es mantener esa conexión y esa relación fuerte. ¿Cómo lo hacemos? Protegiendo a nuestro bebé y dándole los mejores cuidados que podamos darle. Yo creo que con eso concluyo, y siempre les voy a recordar que el desarrollo de un niño en la niñez es lo más importante. Y como padres, como médico, y todas las personas que están encargadas del cuidado del niño, es muy importante que protejamos al niño en su salud emocional, en su salud social, y que todos contribuyamos para que nuestros niños crezcan sanamente. Muchas gracias.
All right, thank you so much, Dr. Reinoso. We are at the final question here. So we were just wondering if there were any additional resources. We've thrown a lot at our parents last couple of weeks, but are there any additional resources you can suggest to expecting parents that can help with preparing for a baby, especially in the time of COVID?
Yes. So the American Academy of Pediatrics, they have the healthychildren.org. And they have beautiful resources, excellent, easy reading material. And there's one specific about like how to prepare for the arrival of your newborn. So very nice information. As I said, very easy to read. There's also many websites, and I'm sure the staff will provide additional resources. But always remember that there's the Postpartum Support International Helpline, the local Department of Health to support families or moms who may be going through depression, the CDC, and don't forget your pediatrician. Your pediatrician is your best connection. So if you have any concerns, any issues, you can always try to reach out to your pediatrician. Now we have the availability of Zoom because we're trying to keep our patients away from the clinic. You have the luxury of having a telehealth video with your provider. So I'll encourage those moms that if they feel they need help, to look for help, to look for support. And there's many resources, as I said. Y lo último es la última parte de cómo podemos ayudar a aquellas mamás. Yo recomiendo que si alguna mamá está atravesando por una dificultad, si está afectando la manera de cómo funciona diariamente, es importante que se comunique con alguien, puede hablar con un familiar. Es muy importante que se puede comunicar con su pediatra. Tal vez su pediatra le puede ofrecer guía. También existe un link que es la línea de apoyo postparto. Es internacional, lo tienen en diferentes idiomas, tanto en inglés como en español. También el Departamento Local de Salud, el CDC, el website del CDC. Así que lo que les pido es de que si ustedes piensan que están atravesando por una situación difícil y que necesitan ayuda, que tienen que hablar y tienen que comunicarse y solicitar esa ayuda para que esa ayuda pueda llegar donde ustedes. Y así esas mamás puedan continuar en sus casas ofreciendo ese cariño y ese soporte a su familia. All right. Any other question?
Actually, yeah, I know we said that was it, but I have one more question. You mentioned postpartum depression. Can you talk a little bit more about postpartum depression? And, you know, is it normal? Is it okay? Is it, you know, should mothers be nervous? What can they do?
So as I mentioned initially, we know that just having the fact of having a baby, there's many things going on, and we experience a lot of stress, a lot of anxiety. Like I can tell you from personal experience as a pediatrician and as being a new mom, like, what is this? I know I'm a pediatrician. I know what babies are supposed to do, but this looks different. Something is going on with my baby. So just imagine someone who maybe doesn't have, you know, the broad knowledge of, you know, how babies behave or why babies cry. So it's very important to address, and yes, it is real. And how do we know if it's happening or not? So what I will recommend that if a mom is going through this emotions of sadness, stress that is affecting her daily living for days or weeks, then that's a red sign, and we need to ask for help. And there's many resources. The pediatrician, you know, she can communicate. And we pediatricians, we are screening for postpartum depression at every visit during the first 12 months of life. So we're doing that. So there's many resources, calling a local department, you know, talking to someone, to a friend, to a family member, someone that can help. It's very important to address this. Mm-hmm.
Thank you. And could you translate that to Spanish? Do you mind?
Oh, sí. Entonces I'm sorry. La pregunta fue acerca de que acerca de la depresión de posparto. Entonces comenté que es real, obviamente es real. El hecho de tener un nuevo bebé en la casa, ¿verdad? Hay muchos cambios. La mamá experimenta un estrés, ansiedad. A veces las mamás no entienden por qué los bebés se comportan de una u otra manera y no saben si eso es normal. Y yo les puedo hablar por experiencia, ¿no? Tanto al ser doctora, también como ser mamá. Cuando tuve un bebé y ya era un pediatra, me llamaba la atención muchas cosas que hacía el bebé y decía, uy, o sea, si soy mamá y soy doctora, me imagino la mamá que no es doctora, cómo sentirá o qué pensará ella, ¿verdad? Entonces es real, pero lo más importante es de cómo sabemos si esto es simplemente un poco de tristeza, los cambios del nuevo bebé, o de verdad es algo que tenemos que alarmarnos y tal vez comunicar. Si una mamá experimenta estas emociones de tristeza, que ya están empezando a afectar su diario vivir por días, por semanas, entonces ese es el momento en que tenemos que pensar de que tenemos que pedir ayuda, tenemos que hablar con alguien, tal vez nuestra pareja, un familiar, el pediatra del niño. Muchos pediatras, si no son todos, estamos haciendo lo que es un escrutinaje para depresión durante los controles hasta el año, así que también eso es importante. Pueden comunicarse con el médico, con alguien, pero lo importante es, tienen que hablar con alguien, pedir ayuda, porque la salud emocional es muy importante, porque eventualmente va a afectar a la familia. Si la mamá no está bien, entonces la familia va a ser afectada, el bebé va a ser afectado, el bebé no va a crecer saludable. Entonces es muy importante pedir esa ayuda. Mm-hmm.
Thank you so much, Dr. Reinoso. We really appreciate you answering all of our questions and translating as well for all of the viewers. We just want to remind everyone that we have many, many resources on our website, which you'll see shared on the screen there. And they'll also be in our comments page. And then also, if we have viewers who don't currently go to a Reach Out and Read clinic, check out our website and you can find your closest Reach Out and Read clinic. And when you visit a Reach Out and Read clinic with your baby, you get a free book with every visit to take home and to keep for you and your baby. So we definitely recommend going to a Reach Out and Read clinic.
Bueno, les recomendamos y les queremos decir de que ahí han puesto los links allí en el website de importantes recursos. También que algunas clínicas, especialmente la clínica en la que yo sirvo en Long Island, en Hempstead, tenemos el programa de Reach Out and Read y les damos un librito a todos los niños hasta los 5 años con cada control. Así que es importante también de que si es que van a una clínica que tienen el programa de Reach Out and Read, que pregunten por su libro.
Thank you so much again. We really appreciate it. And I know you helped a lot of our families. So thank you so much for joining us. And we hope everyone has a great evening.
Thank you very much. Muchas gracias a todos. Que tengan una buena noche. Bye-bye.
Bye.
Thank you.
Thank you.